Assalamualaikum warahmatullahi wabarakatuh. Perkenalkan, nama saya adalah DEVI HELLYSTIA. Saya adalah dosen Fakultas Sastra dan Budaya, jurusan Sastra Inggris Universitas Gunadarma. Bidang keahlian saya adalah pendidikan bahasa Inggris. Salah satunya adalah ESP atau English for Specific Purpose. Mata kuliah English for Specific Purpose yang saya ampu adalah English for Midwifery Student 1 yang diberikan kepada mahasiswa S1 Kebidanan Universitas Gunadarma. Mata kuliah ini memiliki bobot 2 SKS. Pada kesempatan ini saya akan menjelaskan metode pembelajaran yang saya terapkan pada mata kuliah English for Midwifery Student 1, yaitu DIA, Delivery, Interaction, dan Assessment. Sebelum saya menjelaskan lebih lanjut mengenai metode DIA ini, saya akan menjelaskan deskripsi singkat mata kuliah Bahasa Inggris Kebidanan English for Midwifery Student 1. Sebagaimana telah disebutkan sebelumnya bahwa English for Midwifery Student 1 termasuk kategori English for Specific Purpose. Keterampilan listening dan keterampilan speaking menjadi prioritas utama dalam proses pembelajaran. Topik yang diberikan berbasis tema, menyesuaikan dengan kebutuhan komunikasi bahasa Inggris mahasiswa kebidanan. Tema utama dari materi English for Midwifery 1 adalah keterampilan umum kebidanan. Dengan mengikuti mata kuliah Bahasa Inggris Kebidanan ini, mahasiswa diharapkan mampu menguasai keterampilan bahasa Inggris sekaligus menyelesaikan tugas-tugas terkait dengan materi Bahasa Inggris Kebidanan. Mahasiswa juga diharapkan mampu memahami dan menganalisis permasalahan dan isu sosial dan praktik profesional dalam bidang bahasa Inggris, khususnya dalam menguasai pemakaian unsur kebahasaan yang dibutuhkan dalam komunikasi bahasa Inggris kebidanan. Untuk mencapai tujuan pembelajaran tersebut, mahasiswa diberikan topik-topik yang akan didiskusikan selama 14 kali pertemuan dengan menggunakan synchronous learning, di mana saya selaku dosen bersama para mahasiswa akan melaksanakan atau berada di tempat yang sama pada waktu yang sama secara online melakukan kegiatan pembelajaran. Pada tatap muka online yang digunakan adalah Gmeet atau Zoom Meeting. Berikut ini adalah topik-topik dalam English for Midwifery Student 1. Yang pertama yaitu the role of midwives. Yang kedua adalah principle of professional conduct of midwifery practice. Yang ketiga, understanding medical midwifery equipment and supplies. Yang keempat, female reproductive system. Yang kelima, treating health problems. Yang keenam, asking, filling in medical report in the first visit to a midwife, part 1. Yang ketujuh, asking, filling in medical report in the first visit to a midwife, part 2. Yang kedelapan, establishing relationship in the first visit to a midwife, part 1. Yang kesembilan, establishing relationship in the first visit to a midwife, part 2. Yang kesepuluh, effective communication between a midwife and patient, part 1. Yang kesebelas, effective communication between a midwife and patient, part 2. Yang ke-12, difficult relationship and difficult conversation with patients. Yang ke-13, therapeutic communication strategies in midwifery, part 1. Dan yang terakhir, yang ke-14, yaitu Therapeutic Communication Strategies in Midwifery, Part 2. Selanjutnya, saya akan menjelaskan metode DIA yang sempat saya sebutkan sekilas di bagian awal. Yang pertama adalah delivery. Dalam metode DIA ini, saya menggunakan student-centered learning atau pendekatan yang berpusat pada mahasiswa. Mahasiswa dipandang sebagai agen utama di dalam proses pembelajaran. Hal ini sangat berbeda secara signifikan dibandingkan dengan metode tradisional. Model-model strategi berbasis student-centered learning yang saya terapkan kepada kelas English for Midwifery Student 1 diantaranya adalah project-based learning, problem-based learning, dan interactive learning. Strategi-strategi tersebut saya yakini dapat meningkatkan pemahaman untuk belajar dan menyimpan informasi bagi mahasiswa English for Midwifery Student 1. Mahasiswa harus diberikan banyak kesempatan untuk menggunakan strategi pembelajaran yang telah diajarkan melalui instruksi yang eksplisit. Interaction. Pada bagian interaction, saya memberikan peluang kepada seluruh mahasiswa untuk menggunakan bahasa Inggris dalam berbagai konteks di seluruh area topik yang sedang diajarkan pada saat itu. Hal itu dilakukan dalam bentuk pemberian stimulus berupa pertanyaan-pertanyaan sederhana dalam bahasa Inggris untuk dijawab langsung oleh para mahasiswa. Seluruh mahasiswa diberikan kesempatan untuk berpartisipasi penuh secara aktif di dalam misalnya memperdebatkan suatu konsep atau suatu kasus di dalam bahasa Inggris. Hal ini memberikan kesempatan kepada seluruh mahasiswa untuk terus melatih keterampilan berkomunikasi bahasa Inggris mereka. Mahasiswa diberikan kesempatan untuk berkolaborasi dengan teman untuk mempraktekkan model percakapan bahasa Inggris pada topik yang sedang dibahas. Assessment. Model assessment formatif selalu saya lakukan untuk memberikan atau mencari informasi mengenai kegiatan belajar mengajar yang sedang berlangsung dengan memberikan umpan balik yang segera. Biasanya saya menilai pemahaman mahasiswa dari sebuah teks menyimak dan menggunakan hasil penilaian tersebut untuk memperbaiki perencanaan pembelajaran pada pertemuan selanjutnya. Lalu bagaimana saya mengambil nilai dari mana mahasiswa tersebut? Ketentuan penilaian sudah saya tetapkan di awal semester berjalan, tepatnya pada saat saya menyampaikan kontrak perkuliahan, sehingga setiap mahasiswa mengetahui apa saja yang harus mereka perhatikan kaitannya dengan pencapaian hasil assessment. Secara umum, bobot penilaian terdiri dari 70% untuk nilai ujian tengah semester dan 30% untuk ujian akhir semester. Berikut ini adalah cuplikan kegiatan mengajar English for Midwifery 1 yang dilakukan secara online.
Okay, everyone. Good morning, everybody. Hope you are keeping well and healthy. Good morning, everyone.
Good morning, ma'am.
Okay, now welcome back to our English for Midwifery. In today's lesson, we will be learning about treating health problems during pregnancy. Okay, beforehand, before we go to our activities, everyone here will be presented by a PowerPoint. So please wait for some time. I will share the PowerPoint here. Okay. Okay. Everyone, can you see the PowerPoint?
Yes, ma'am.
Okay, good. Okay. This is our today's discussion, treating health problems during pregnancy. What will you have, or what is the learning objective? Okay, our today's learning objective is you're able to communicate in English about treatment for the health problems during pregnancy, specifically about the following important things. Number one, finding the causes of health problems. Number two, finding the best treatment. Number three, finding root causes of health problems. And number four, how midwife can make changes for this or for the problems. Next, this is the learning activities. In this session, you will be having some set of activities. What are they? Number one, we will be having a brainstorming. Number two, reading comprehension activities. In this regard, we will be watching a video. And then afterward, you will be retelling from what you see from the video. And number four, making a summary. I will ask two of you to make a summary of our today's discussion. And number five, evaluation. Understand, class?
Yes, ma'am.
Okay, good. Now we'll go to our first activity. Now everybody, can you see the screen? Can you see the picture on the screen, class?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, good. Now look at that. How many problems that appear on the picture? How many problems there?
There are
7.
7 problems.
Okay, 7 problems. Okay. Lutfia Adisti, can you please help me to mention all of the 7 problems you may a pregnant lady may face during pregnancy?
There is breakage, thick hair, thin hair, fatigue and fatness, change in the skin, bladder problems, and morning sickness.
So those are the 7 problems a pregnant lady may face during pregnancy. Okay, now go to the next list of questions. Okay, after you look at the picture and you indicate 7 problems that may be encountered by a pregnant lady during pregnancy. Now, I want some of you to answer the question related to this issue. I will give you 1 minute to prepare the answer. This question comprise 1. What is a healthy pregnancy according to you? Number 2, what are the most common health problems that might be occur during pregnancy? Number 3, a pregnant lady has a limited access to non-prescription medicine for health problems during pregnancy. What should a pregnant lady do if she feels unbearable? Okay, 1 minute. Okay, done? Anissa, can you answer? What do you think a healthy pregnancy is? Anissa Raihani?
A healthy pregnancy is a healthy pregnancy without a risk. There are some a healthy pregnancy is nausea and vomiting, sensitive to food and smells, frequent urination, breast pain.
Okay, good. Thank you very much for the answer. Now we'll go to Afifa. Can you answer what are the most common health problems that might occur during pregnancy?
This actual during pregnancy may be like cramps, back and forth urination and incontinence, bedwetting, heartburn and indigestion, varicose vein, back pain, constipation, and hemorrhoids.
Okay, so next, a pregnant lady has a limited access to non-prescription medicine for health problems during pregnancy. Rifa, according to you, what should a pregnant lady do if she feels unbearable?
Maybe consult to the midwife.
Okay, she may consult to the midwife. Okay, what do you think the midwife can do with this to sort out the problems?
give some advice
Mhm.
with the
So she may give the lady some advice related to the health issue. Okay, good. Thank you very much, Viva. Okay, class. Now look at this. We are coming to reading comprehension. In this reading comprehension activities, the thing that you will do is listen and read carefully to the audio text. Listen and read carefully to the audio text, okay? And you will see the title of the text is Finding the Causes of Health Problems During Pregnancy. Now, please get ready for this. Okay, look at this.
Pregnancy is typically a time of joy and anticipation. It can also be a time of anxiety and concern. Listening and talking respectfully and sensitively with the woman and her family can help build the woman's trust and confidence in her healthcare providers. Most of the daily work of a midwife is treating health problems. When a woman you are caring for has a problem like exhaustion, pain in the belly, or even heavy bleeding, finding the causes is the first step that you will need to take. The steps are helpful to a midwife to find out what happens to your client. 1. Start with the doubt. This means start by admitting what you do not know. 2. Think of all the possible causes. Most ways of feeling sick can be caused by many different problems. 3. Look for signs to find the possible cause. Health problems have signs. You can see the signs in how someone feels, how their body looks and acts, and by taking medical tests. 4. Decide the most possible cause. 5. Make a plan for what to do. This could be a plan to change person's habits, change something in their home or environment, or give a medicine. 6. Look for the results. Find out if your treatment is working. If it is not, start the steps again. Most death and injuries from pregnancy and childbirth can be prevented by looking at and treating root causes. However, to do so, a community must look beyond the experiences of individual women. Look at the common dangers that affect all women in pregnancy and birth. In addition, use the skills of every community member to protect women's health. Midwives who are most experienced with birth can tell others in the community why women are dying and being injured during birth. Families, midwives, and other health workers and community members can work together to make changes, small and large, to improve health for all. When everyone in the community becomes involved with health, we can do much more than one midwife alone.
Okay, that's the session of video session in which you're watching the video. You're watching the video about how to treat or yes, how to treat problems during pregnancy. Now we go to the language focus. The language focus that may involve in this type of learning is the discourse marker. The question is, what is a discourse marker? Discourse marker, a word or phrase, function to organize discourse into segments. Examples. In conclusion, marks the summary and round out your essay or speech. In conclusion, eating a healthy diet during pregnancy will contribute enormously to the development of a healthy baby. Or In summary, another way to mark conclusion. Summary. In summary, a short daytime nap may be solution for a woman who have a deep fatigue during trimester of pregnancy. Next, moreover is a further matter. There is even more to tell. Example, the midwife may ask you to see you on your own at least once in case there is anything you want to tell her that you don't want to say in front of the other person. Moreover, you can also bring someone to your ultrasound scan appointment. That is an example of moreover. That's the discourse marker. You may need it in the communication for this issue, treating problems during pregnancy. Okay, now class, we are in the evaluation part. Okay, look at this. How many numbers here? You will have 5 numbers here to be answered. I will ask you one by one to answer that question. Now we'll go to Anissa Raihani, please. Number 1. Read and answer.
Pressure, swelling of hands and face, too much protein in urine, stomach pain, blurred vision, dizziness, headache. It's preeclampsia.
Okay, God. Thank you very much. Fifa, please, number 2.
Yes, ma'am. Fever, muscular issues, charge, sometimes diarrhea or nausea if progress, severe headache and stiff neck is listeriosis.
Okay, good. Very good. Thank you very much. Lutfia Adisti, are you there? Lutfia?
Yes, ma'am.
Okay, good.
Yes.
Number 3, Lutfia.
Abdominal pain, shoulder pain, vaginal bleeding, feel dizzy or faint is miscarriage.
Okay, miscarriage. That's good. Thank you for the answer. Now, next, Anissa Anindita, please.
Yes, ma'am. 4. Baby moving less than normal. Baby is smaller than normal for gestational age. The answer, fetal problems.
Fetal problems. Okay, good. Tania, are you there?
Yes, ma'am.
Okay, good. Please, the last number.
Vaginal spotting or bleeding, cramping, or abdominal pain, fluid or tissue passing from the vagina is ectopic pregnancy.
Ectopic pregnancy. Okay, perfect. Thank you very much for the answers. Okay, class. Now we come up to the summary of our today's topic. Okay. Now we'll go to Anissa Raihani and Fifa. Please give your summary on our today's discussion. Okay. Please.
Okay, from the lesson today, I draw summary. Complication during pregnancy can be a health problem that can involve the health of the mother, the health of the baby, or both. Some women have health problems that arise during pregnancy, and others have health problems before pregnancy that can lead to complication.
Okay, that can cause complication. Okay, good. Thank you for the summary. Okay, Anissa, this is the very last.
Okay, ma'am. The summary of our discussion today is to learn the meaning of a healthy pregnancy and how to treat patients who are not allowed to drugs during pregnancy, as well as problems in pregnancy. Thank you.
Okay, thank you very much. Okay, this is the end of our today's session. Don't forget to work with our next project, with the project that will be given after this session. See you again in our next meeting. Don't forget that you have to keep on practice because practice makes perfect. Thank you for coming. See you again. Good afternoon. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam
Warahmatullahi wabarakatuh.
Thank you very much.
Thank you, ma'am.
Thank you, ma'am.